Hello, my name is John Outdyke. I'm with the Occupational Health Clinics for Ontario Workers. The health clinics for Ontario workers are a group of clinics throughout the province. We have 6 of them. And each clinic has staffed by a multidisciplinary group with occupational physicians, occupational health nurses, ergonomists, hygienists, and support staff. And we're here to service health and safety committees in their struggles to improve the health and safety in the workplace. Now today we're going to talk about measuring stress. Now why would you want to measure stress? We all know there's stress in the workplace. We're constantly getting more and more demands. There's restructuring, there's layoffs, there's increasing responsibilities. With the Drummond report, things are only going to get worse, obviously. And we already know we're under stress. Our members are getting burned out. We have harassment, we have violence. We know of people who are depressed. We know of families that are struggling, even some people struggling with alcoholism or drug dependency. But in these days, in order to get something addressed, you have to prove it. So how can we prove that stress in the workplace is a real problem that needs to be addressed? Well, you could look at sickness and accident stats. All you have to do is look at the number of people away on stress leave. Even your own experience. How many times have you taken a couple days off just to get some mental health break for yourself? But the problem with looking at accident statistics is you get a focus on the individual, and that leads to blaming the victim. For instance, if John is off on a stress leave, well, we start to think about John's abilities to handle stress, and we think, well, he's just not up to the job. And what happens then is somebody else who's also suffering from similar symptoms but not quite off the job will say, hey, look what they're doing to John. They're kind of blaming him for all his problems. I better be quiet about mine. So what we need is some way to capture those feelings that are being hidden because of fear of being blamed and develop some type of objective measure of stress in the workplace that doesn't focus on the individual. So how can we make the case? Well, the nice thing about using questionnaires is you get some level of anonymity. It's confidential, so people can tell you what's going on. It allows the union also to deal with it collectively without just focusing on the individual. Now, you can make up your own questionnaire, and I know a lot of unions that have done that, but making up your own questions, although it's easy to do, can cause some problems. For instance, you could be accused of bias. You've rigged the questions to get the result you want. You might have missed something important. So a better way of doing this would be to use established, validated surveys. And what that allows for is that somebody has spent some time on developing a good questionnaire and has developed some data that you can compare your results to. Now, the overall strategy of this is that we're developing a tool that you can use in your shop floor and figure out what role stress is playing amongst your members. But that can also be fed back to the union, so they can look at similar workplaces to yours and see the patterns that are happening there, and they can provide supports based on those results that you need to address stress in your workplace. Further, ONA can work with other unions and try to bring the issue of workplace stress in front of the legislature so that we can have legislative changes, and also at the compensation level so that compensation recognizes the effects stress is having on the workers on the shop floor. Now, this has been done before. This is not something new that we're inventing here. In Spain, the unions got together with academic researchers and developed a tool to address psychosocial hazards. And what they did is they created committees which oversaw the use of this particular questionnaire in the workplace to assess psychosocial hazards. Now, in Europe, you have different laws. They have a requirement in Europe that employers have to evaluate psychosocial hazards in the workplace. This survey, which is based on a survey that was developed in Denmark, has also been used there in the general population. So in Denmark, we also have data that's been gathered from a cross-section of the population, and that serves as a really good comparison. So you can take your data and compare it to a cross-section of the population. So literally, this questionnaire has been used in thousands of workplaces. A few Canadian ones have also used it, but not as many, because we don't have any law that requires employers to evaluate psychosocial hazards. At this point, I want to step back a bit and talk about different perspectives on stress in the workplace, because we need to address a few fundamentals before we get into the details. So there's basically two models that you can describe that look at stress. One is the biomedical model, and that one is focused on the individual. We look at stress in terms of how people are coping and whether they have any sufficient psychological defenses to manage the stress they are experiencing. The other side is the social epidemiological model, which is focused on the environment. There, the idea is that stress comes from the environment, and we need to change the environment to reduce the stress rather than focus on the individual. Now, the WHO has a model, which is shown here, which has both aspects in it. It has personal factors in it, but it focuses on the risk factors for work-related stress, like job content, workload, control, the type of equipment you have, but it also includes some of the individual characteristics. And this is the model that the Copenhagen Psychosocial Questionnaire uses. Now, we also want to distinguish three different levels of prevention. There's the primary prevention, which is taking action at the source to eliminate the source of the stress, and by that we mean changing the job design, rearranging responsibilities, having some flexibility, things like that. At the secondary prevention level, we're looking at what people are experiencing and how they're managing it. So we may be asking questions about symptoms, but we also may be educating them on stress relief methods, wellness programs, and things like that. The last level of prevention is tertiary prevention, and here's where we help the victims, the people who have been broken by stress in the workplace. So what we're trying to do for them is try to get them to some proper treatment. We're trying to get them recognition for compensation, some type of a program to get them back into work again. So it includes EAP, or employee assistance programs, and therapy and things like that. So those are the three levels of prevention, and now we'll delve a little deeper into the Copenhagen Psychosocial Questionnaire, and we'll use the short form COPSOQ. The Copenhagen Psychosocial Questionnaire has a number of factors that it asks questions about, and I've grouped them here in the slide according to a number of overall categories. The first one is the category of work demands. These are the quantitative demands, how much work you're expected to do, the pace you're expected to do it, but also we know that the emotional demands of a workplace can also cause workplace stress. Next, there's the aspect of work organization. This includes how much influence you have over the job that you do, the possibilities you have to develop, whether you can be promoted or expand your responsibilities, the meaning of work to you, the amount of commitment you have to your workplace. The next aspect is work values. This is how much trust you have, especially in relationship to management, and the type of justice and respect that you see and experience in the workplace. The next factor is workplace relationships, and these are how predictable things are in the workplace, whether you get recognition for a job well done, how clear your role is defined, the quality of the leadership, also the social support you get from your supervisor. Then we ask questions about work-life balance, whether you're satisfied with your job, whether the work conflicts with your family life. And finally, we ask 4 questions about offensive behaviors, and these include sexual harassment, the threats of violence, actual physical violence, and bullying. The COPSOQ questionnaire is rather unique in contrast to other stress questionnaires in that it includes questions about symptoms, not just the risk factors. And these include burnout, general stress questions, trouble sleeping, somatic stress symptoms, which include, things like upset stomach, cognitive stress symptoms, which includes troubles concentrating, thinking clearly, making decisions, and remembering, and those type of things. Now, the special thing we can do when we ask about symptoms and risk factors is we can statistically evaluate whether there's an association between the symptoms and the risk factors. It's not just that you're experiencing some type of a stress-related problem at work, but that work-related stress problem is actually causing disturbances in your sleep or burnout or that type of thing. So that's what this questionnaire can do that other questionnaires can't, is link the exposures with the actual health effects. So that's an overview of the Copenhagen Psychosocial Questionnaire, and it's a key element in a kit that we're trying to put together for health and safety activists like yourselves to use in the workplace to measure stress and to identify what the issues are, and also some supports to try to get things changed so that stress is dealt with appropriately in the workplace. At the workplace level, we're looking at some type of a one-pager that you might be able to hand out, a flyer or something like that, that might generate some interest in the topic. But once you've got the interest and the people are motivated to do something about it, then we've got the kit and some training program to teach you how to use it. And this is what's happening during the session today. Hopefully we can collect this information from a large number of workplaces so that we get a good picture of what's happening in the province, and then we can work collectively to make changes, not only in the legislation but also in the compensation, so that we have better supports for workers on the shop floor when we're dealing with stress. So there you have the toolkit. We put this thing together so that people like you, activists on the shop floor, can use it to measure stress and to find solutions to it. Now, if we put our efforts together, everyone collecting data, feeding it together, we can make the general case that workplace stress needs to be addressed, not only for the benefit of our members, but for the benefit of society in general. Thanks for listening. Thank you for filling out the survey, and all the best in your efforts in trying to address stress in your particular workplace.